VRpatients is a program designed primarily for the pre-hospital market, for EMTs and paramedics, and also nursing applications. But it's designed to judge people's critical thinking skills. What do they do first, second, and third when assessing a patient? So we can run this two different ways. One on a computer, so it can be done remotely. All that remote learning comes in handy this day and age of disease and not able to gather. Or the really great way is through a VR headset and be able to be fully immersed inside an environment taking care of a patient. So here you can see Dwayne's running a case. We've got it mirrored up on the TV, but that's a life-size patient to Dwayne. And Dwayne's making choices based on his training about what to do first, second, and third to take care of this patient. You can see his menu there. He's got a controller in his hand, so he's squeezing the controller to select things. There's his monitor, and he can move that around and make it advantageous. So he's going to do all the things that his training is designed to help that patient get better, including asking questions, giving medications, or doing whatever. The great thing about the program, though, is the cases can be run, but they can also be tweaked by the instructor. So we call that an authoring tool, and the instructor can go in and change the way the case flows. So if you want to use a different drug or you want to introduce something different, just by using a mouse, the instructor can go in and make changes to the way the case works. Not only that, but you can also build a case from scratch just by using the mouse. It takes a half hour to an hour, depending upon your skill level to build a case, but you can build any kind of case that you want. When he's done, he's going to get a grade that's very objectively based on how he did in taking care of this patient. So you can see now he's nearing the end. He's taking care of the patient. He's got him on a CPAP machine. They're in the back of the vehicle, and he's continuing to work this. The cases are timed, and so at the end of the time, the end of the case, he'll get a grade that'll tell him how he did based on what the instructor set up. Those scores will be stored in the system, and then the educator can have a conference with the student to talk about their results. So the whole idea is to give people a chance to practice with patients without really doing this on real patients when they're students. So it doesn't matter if you make a mistake, you're not hurting anyone. The great thing about it is you can see all kinds of patients all day long, where in real life, a paramedic may only see one chest pain case every week or so. So here you can run 10 or 12 a day over and over and over again until you get better at it. So when you do encounter a live patient, chances are you kind of already know what to do.